Hi everybody, I am Dr. Britt Talley Daniel MD, a neurologist and headache doctor, and I have a large blog on migraine at drmigraine.com where I have a lot of articles, and I wish you would check on the subscribe button over there so we can follow each other. Now today I'm talking about what is postpartum migraine. Well, the term postpartum refers to the period of time just after delivery of a baby. And the word partum refers to the perfect passive participle of the Latin word pario, which means I bring forth, give birth, acquire. This refers to delivering a baby, and post means after. So postpartum refers to a period of time after the delivery of a baby. After a baby is born, there's usually a great change in the life responsibilities of everyone in the household, namely the mother and the father. The first few weeks at home with a newborn are joyful, but also a challenge for all the family members. 25% of women have migraine. About 70% of them have menstrual or estrogen relationship with migraine, usually with their menstrual cycle, where estrogen is high for 3 weeks and then goes low with progesterone dominating in the next week, and then it starts all over. Many women are not informed or warned about migraine recurrence after childbirth. So pregnancy is a high estrogen time. During that time, migraine is rarer or improved during that time. So it only comes again after the baby's born and the menstrual cycle starts up again. And these headaches at that time would be called postpartum migraine. Now, if you go to my blog article on this, I have graphs and a picture of the estrogen cycle. So what is postpartum migraine? This is the occurrence of severe, sudden migraine headaches that come after the reestablishment of normal menstrual cycles after childbirth. Estrogen rises for 3 weeks and the headaches come as the estrogen levels drop. Many of these times, these headaches postpartum after childbirth are somewhat worse than the patient's usual previous migraine experience. Some women present at that time, and the first time in their life ever, of having a migraine headache, and that usually happens with the first baby. The migraines come several days before, at the time of bleeding, or 2 days after bleeding. And postpartum migraine may be delayed by breastfeeding the baby. So related questions. How frequent is postpartum migraine? 1 out of 4 women will have a migraine headache within 2 weeks of delivery, and nearly half of them will have a migraine attacks within the first month. So it's a pretty high incidence. And I'm quoting a doctor here, Angeliki Bontagas, a neurologist at Brigham and Williams Faulkner Hospital, who said, in addition to that, about 5% of women who have never experienced a migraine get their first one in the postpartum period. So we're talking about millions of women every year, and that's a very high number. First-time occurrence of postpartum migraine is very common, but women in this situation are often poorly educated about what is happening and will need to establish a relationship with a neurologist and have testing with lab work and MRI scanning to sort things out the first time to provide an accurate diagnosis and beneficial treatment. Well, why do these bad migraines occur just after childbirth? Again, estrogen and progesterone levels during pregnancy are very high, and many women who had migraine before pregnancy will find their headache symptoms lessen or disappear during that time. What are the migraine triggers after childbirth? Well, I'll give a tip here. It says the best situation, previous migraineurs should discuss the recurrence of migraine headaches with their doctor and plan for them with an adequate supply of medication, headache available that previously worked for them for their migraine treatment. So what are the triggers for this occurrence? Sleep deprivation, frequent nocturnal awakenings. This is probably the #1 trigger. The mother may be up for nighttime and early morning feedings and caring for her new baby. So in response to that, she should try to take naps when your baby naps and ask family and friend to watch over the baby between the feedings so she can rest. The next tip, the thing that would bring these headaches on, would be stress or overwork. So the mother should try to relax, reduce rest. She could take a walk and get mild exercise. She could read a book, get out of the house, or chat with her friend or family member to alleviate stress. And just having someone help care of the baby so the mother can sleep provides very great and significant migraine relief. There will be stress from all that has to be done when a baby is born. Mothers may need more help from husbands, other children in the house, like older children, mothers or mothers-in-laws, sisters or close friends. These helpers can be organized so the new mother is not alone with her baby to deal with everything that needs to be done. In the postpartum times, a mother may be more concerned about the baby and the baby's health than their own health. And she may not be able to adequately care for her baby if she experiences disabling severe migraine headaches. That's a real problem. Migraine headaches are disabling, and a person with a migraine usually needs to sleep or lie quietly in bed and can't be up about the house doing things. So another treatment idea or stress that brings this on is dehydration, not drinking enough fluids. So the mother should drink a lot of fluids and have a large water bottle nearby so she can chug it down. Irregular meals. She'll feed the baby, won't eat herself very well. So she should eat well and avoid known personal food migraine triggers, which exist. Mothers should eat healthy foods regularly. And the mother should prepare for all this going on with the baby by stocking the refrigerator and the pantry with foods they can eat that are convenient, easy to fix. Another thing that goes on here is that many patients have an unknown family migraine link. I don't see this all the time with new headache patients that come to the office. So there may be a family history of migraine which may relate to the mother, the grandmother, aunt, or sister. And the doctor should ask for that, but if he doesn't get it, there still may be the link. So many parents with migraine are not diagnosed, and their migraine pseudonyms are what are called false names discussed in the family. And these may be sick headache. Well, migraine turns on your vomit center. Sinus headache. Well, there is no sinus headache. Most of those are migraine. Menstrual headaches. Those are headaches that occur with menstruation and estrogen dropping. Hungry headaches. Low blood sugar gives you a headache. One-sided headache. Migraine comes from a word. It means half of head. Nocturnal headaches in the middle of the night. So the mother with postpartum migraine may have been told their own mother or sister had these false migraine names and not recognize her family link to migraine, which then puts her at risk for an attack. All right, migraine medication and whether or not to breastfeed are questions that come up. Migraine treatment and breastfeeding may affect the baby, and mothers and doctors worry about this naturally, but there are migraine treatments that don't affect the baby. Sumatriptan, a successful migraine-specific drug like a triptan, can be safely used. Caffeine, Tylenol, ibuprofen, and other NSAIDs, that is non-steroidal anti-inflammatory drugs, may be safely used. You can always ask the doctor or the pediatrician these questions. Breastfeeding itself may reduce the occurrence of migraine. Breastfeeding mothers need to always determine if the medications they take are excreted in breast milk and whether they're safe for the baby. I have an article on are triptans to safe while breastfeeding on my blog you may want to look at. The mother may, during the postpartum time, start an estrogen-based contraceptive. The FDA has said that all estrogen-based contraceptives, the pill, the patch, and the shot, are contraindicated with migraine. Contraindicated with a doctor means not to take. Starting a birth control pill then can aggravate migraine occurrence. The usual bottom line here is most often postpartum headaches are tension headaches or migraine headaches, which may be treated safely at home with medication and help from your doctor. More severe secondary headaches should be seen by your doctor immediately and may require neurologic consultation, blood work, and MRI scanning. So there is a differential diagnosis for the incidence of postpartum headaches. It may be the headache the mother's experience is not migraine. What else could it be? So I'm going to give a list of different types of postpartum headache. Well, a common one is caffeine withdrawal headache. Caffeine withdrawal headache are prolonged daily use of caffeine and then abrupt cessation or reduction of total caffeine use. She goes to the hospital, she's in there a period of time, they might get the caffeine she needed as much as she's taken at home. So when you stop caffeine, some patients will have a headache or one or more of the following symptoms, which are called caffeine withdrawal symptoms. Fatigue, drowsiness, anxiety, depression, nausea, vomiting, clinically significant distress or impairment in social, occupational, or other important areas of functioning. Tension type headache. This really is the most prevalent type of headache. It's about 70% of all headaches, where migraine is about 30% of headaches. The tension type headache we're talking about now in the postpartum period. Tension type headache is described as being on both sides of the head, so it's said to be bilateral. It's described as pressure or tight. It's really not allowed to be throbbing. It's maybe like a vice or like a band around the head. And on a scale of 1 to 10, it can only go like to 5, so it's mild or moderate. It's not severe like 10 is a migraine level headache. Patients with tension type headache may also carry tension in their neck and shoulders and have muscle spasm, knots in the back of their neck. Well, preeclampsia, eclampsia. This is serious life-threatening medical conditions that can occur before or after childbirth. So it's late pregnancy, early delivery. It's associated with high blood pressure and protein in the urine and can lead to seizures, a coma, and left untreated, death. The headache with preeclampsia may be pulsatile, bilateral, and worse with activity. There may be visual changes like vision blacking out, abdominal pain, decreased urinary output, and trouble breathing. Preeclampsia, eclampsia are medical emergencies requiring emergent medical treatment. You don't mess around with that one. Post-dural puncture headache. It may not have just been an epidural headache, which is if the doctor inserts a needle in your back, she's giving you an epidural shot for anesthesia. And epi means above the dura, so he puts the needle in above the dura, which is the covering little sac that covers spinal nerves in the lumbar area. But sometimes accidentally he'll go through the dura, and when he does that, he can cause a little hole, so the spinal fluid drop out, and you get a headache from that. It's called post-dural punctural headache. And that's usually characterized by being worse when up and better when lying down. There may be something like a stroke from cortical vein thrombosis. Pregnancy is a hypercoagulable state, and sometimes cerebral veins clot. Symptoms of this may be headache, blurred vision, fainting, loss of consciousness, paralysis of one part of the body like a stroke, seizures, and coma. Subarachnoid hemorrhage. Symptoms of this may be sudden onset of the worst headache patients ever experienced or imagined in their life, epileptic seizure, double vision, neck and back pain, going into coma. There's a syndrome called PRES, P-R-E-S, which means posterior reversible leukoencephalopathy syndrome. And it presents with rapid onset of symptoms, including headache, seizures, altered consciousness, and visual disturbance. But it may not be associated with, or it may be associated with high blood pressure. Space-occupying lesions. Well, brain tumors usually don't present with headache, but they can do that. They usually present with paralysis of the limbs, visual change, double vision, seizures, memory or speech problems. Also, you can have a subdural hematoma, which usually comes after a fall or blow to the head, which puts blood in the head. You can have a cerebral infarction or ischemia. These may be stroke symptoms. Headaches in this situation. So one study found in a sample group of 95 women with postpartum headache that 50% of them had tension headache or migraine. 24% had headache related to preeclampsia, and 15% had headache caused by regional anesthesia, which was a post-dural puncture headache. I'm also going to talk about an article that was done by Hoshibama in Internal Medicine in 2012 entitled Postpartum Migraine. Not a lot of research in this area. This was an article in response to the fact there wasn't much data regarding the course of migraine. So they investigated the patients suffering from migraines over a long postpartum period in an OB ward in Japan. And this was a prospective study of the course of migraines, the postpartum period by patients in a postnatal ward. Okay, so they were surveyed during the first postpartum week at 1, 3, 6, and 12 months after delivery. And they were given a headache diary, write everything down so that they could see the medication use and the migraine attack frequency and severity and that sort of thing. 83% and 85%, that means getting better during the first, second, and third trimesters respectively. No patient experienced a worsening of headaches during pregnancy. Headache recurrence during the first month after delivery was more frequent in patients over 30 years of age than in those less than 30. So the older you get, the worse headaches may be. The percentage of women that experienced recurrence at 1, 3, 6, and 12 months after delivery was, this is recurrence, 63%, 75, 78, and 87% respectively. But in breastfeeding patients, the rates were 50, 65, 71, and 91. And in bottle feeding patients, the numbers were 86, 90, 95, and 31. So the doctor concluded 85% of patients with migraines experienced remission during pregnancy, and more than 50% experienced recurrence during the first month of delivery. Until 6 months after delivery, breastfeeding is associated with a lower recurrence on that. So again, in my talk on what is postpartum migraine, I hope it's helpful to all you migraine patients. God bless you. Stay tuned for the next talk here. See you later.